हेलो।
गीतांजलि है।
हाँ मैम, मैं कर देता हूँ आपको उस पर फिर।
हाँ, फिर प्रेजेंटर बना दो।
ठीक ठीक है मैम, मैं कर देता हूँ। हेलो।
हेलो।
हाँ मैम, कर दिया मैंने।
ये ओके, तो ये गो टू मीटिंग वो
हाँ,
एक्सेसिबिलिटी फीचर्स वो कर लूँ क्या?
ये गो टू
ओपन
मीट।
सिस्टम।
हाँ जी हाँ जी, मैं अपने यहाँ से मैं इसको ऑफ कर रहा हूँ मैं।
क्या कर रहे हो?
मैं माइक ऑफ कर रहा हूँ, ये अब आपके उससे होगा अभी ये।
ओके। आगे एक मिनट इधर आ। वेट। अच्छा,
नई सेटिंग हो गई क्या? नई सेटिंग कर दी क्या? कर दी।
हेलो। मैं ना वो शेयर नहीं कर पा रही हूँ। हाँ वही तो, मतलब एक मिनट आप रुको। आप वही हो ना? एक मिनट, अगर नहीं हुआ तो मैं वहाँ आ जाऊंगी।
हाँ जी मैम।
हाँ मैं आ रही हूँ, मैं वहीं से लेती हूँ।
आगे से आगे से
ओके, अच्छा वीडियो भी स्टार्ट है. तो वीडियो ऑन रहेगा. Good afternoon. Good afternoon, everyone. So I am Dr. Good afternoon. So I am Dr. Gitanjali Bade, working as Assistant Professor in Department of Physiology. Good afternoon. Good afternoon. So now we are starting with the systemic physiology, and I am taking blood or hematology. So in hematology we will deal with the what are the different cells in blood, what is their function, how they are formed, what are plasma proteins and what is their function. Okay, and what is hemostasis, what is immunity. So all of these things we will cover in hematology. So so there are certain rules for online lecture, okay, and you have to follow these rules. So I will take the lecture, and at the end of the lecture you will ask questions. You can unmute yourself and you can ask the question directly, because I'm not having any access to the chat box. It is very difficult for me to go to the chat box and answer your questions. So at the end of lecture you will unmute yourself and you will ask a question. Is it clear to all of you? So we are starting with the hematology today. So this is very interesting topic, and especially during the days of corona, you must be knowing that there is inflammation and it is affecting whole body system in patients who are having corona, and after once they recover also they are having symptoms because of this. So good afternoon. Okay, so we'll start with the today's introductory class, but in introduction we will cover some part also, some study also. Okay, so what is blood? So these are the different lectures which will be covered during hematology lecture series. So we have in total 13 lectures, 2 problem based learnings and 1 tutorial. So in total we will have 16 classes, and today's lecture is introduction to blood and functions of plasma proteins. So what are the learning objectives for this lecture? So what is the meaning of learning objectives? That is, what topics will be covered in this lecture, and at the end of this lecture what you should know. So once the lecture finishes, you should be able to describe what are the form elements of the blood. You should be able to differentiate between plasma and serum. You should be able to list major plasma proteins and describe the function of these plasma proteins, and you should be able to define plasmapheresis and its potential uses. So let us see whether we are able to fulfill these learning objectives or not. Okay. So at the end of lecture you can go to this slide and you can see whether you are able to answer these questions or not. So these are the learning objectives for this lecture. So let us go to the blood. Now what is blood? So it is a specialized tissue composed of different kinds of cellular and matrix components such as red blood cells, white blood cells, platelets and plasma. So I know that you all know what is red blood cell, white blood cell, platelets and plasma, but let's brush up your knowledge. Okay. So what is function of blood? Now the function of blood is, there are main 3 functions: transportation, regulation and protection. Now what do you mean, what is that, what blood transports? It transports oxygen from lungs to the tissues and carbon dioxide from tissues to the lungs, then nutrients from GIT to the liver and other organs, and waste products from whole body systems to the kidney, and hormones from their site of production to their site of action. So it is very important function which is performed by the blood. Now the next function is regulation. So you know that the maintenance of pH is very important for a proper functioning of our body, because the enzymes function at specific pH. So enzymatic actions are also important. So for that proper function of enzymes, it is important to regulate pH of your body fluids. So another function of blood is to maintain pH. So in this function, the plasma proteins and hemoglobin play very important role. And the next function is regulation of body temperature. Now you know that it is very important to regulate body temperature also. It is regulated within a very narrow range, and there are 2 concepts: core body temperature and peripheral or surface body temperature. And depending upon the environmental temperature, the blood vessels or capillaries which are present in our screen, they either constrict or dilate, and blood performs very important function in regulation of our body temperature. Now protection. So you know that whenever there is any injury or bleeding, then platelets come into picture and they form a thrombus, and that is important to stop blood loss. So it is a homeostasis. Now what is homeostasis? I think you have the next lecture on homeostasis. So blood plays very important role in homeostasis also. Means whenever there is blood loss, the platelets will act and they will prevent they stop the blood loss. Now leukocytes are important to provide immunity. Like if you have bacterial infection or viral, parasitic, if there is any infection, then leukocytes will come into play, and depending upon which number of these different types of leukocytes, we can make a differential diagnosis also, whether it is a bacterial infection, viral infection. So it is only a differential diagnosis, but the leukocytes play a very important role in providing immunity. So The components of blood are cellular elements or formed elements, and these are RBCs, also called as erythrocytes, WBCs, also called as leukocytes, platelets, also called as thrombocytes, and another part is the plasma, which is formed by the water and dissolved solutes. Now what is the proportion of these form elements and plasma, we will see later. So these are the RBCs. This is a peripheral blood smear. Now how we prepare the peripheral blood smear? So we take a drop of blood and spread it evenly on a cover slip. Okay, so this is a monolayer film which is formed over the cover slip, and then we stain it with the different stains, and based on the pH of stain and pH of the contents of these cells, they get stained. And this is the peripheral blood smear showing different types of blood cells. So the central the abundant one, which are red in color with central hollow, these are the RBCs. So we identify them with the presence of their color and the central hollow. Now central hollow is present because they are biconcave in shape. So it gives in a 2D structure, it gives the central hollow. Now the other cells are WBCs. So we have lymphocytes, neutrophils, monocytes, basophils and eosinophils. So all cells are visible in this slide, and on the left side the small dots which are clustered together, so that blue small dots are the platelets. So in this slide you can see all the cellular elements which are present in the blood. Now this is a scanning electron micrograph showing the RBCs and WBCs. So RBCs are the biconcave discs which are present abundantly, and WBCs are present in between. At the center there are WBCs with surface markers, with some projections on the surface. So these are WBCs and rest are RBCs. So let us see few things related to RBC. So these are the biconcave discs which are having diameter of around 7.5 micron, and the thickness is around 2 micrometer, and at the center it is less, around 0.5 micrometer. So they don't have nucleus. So these are the only cells with platelets are not cells, these are the particles, but RBCs are the proper cell, but they don't have the nucleus. And even though they don't have nucleus, their lifespan is around 120 days. So they can sustain for 120 days without having nucleus. Okay. So, and what is the function of RBC? They carry hemoglobin inside them, and so they carry hemoglobin. So the function of RBC is to carry hemoglobin. Now why it is important to have hemoglobin inside the cell? Can we have it directly inside the blood vessel? So we have one lecture on erythrocytes. So during that lecture you can answer me this question. So why it is important to have hemoglobin in one cell? Can we have it freely available in the circulation? So what will happen if there is no RBC, or if there is hemolysis? What will happen? So you will answer it in my next lecture. So the function of RBC is to transport hemoglobin, which will carry oxygen, and the typical concentration or level of RBCs is, in males we have around 5.4 million per cubic millimeters RBCs, and in females we have 4.8 millions per cubic millimeter. Now this is a normal typical concentration, but we always say it in a range. Okay, like in females we have 4 to 5 million per cubic millimeter, because we don't have any fixed value based on the gender, based on geography, based on race. these all the values, and based on age also these all values differ, and we don't give the specific values, we always express it in a range. Now what is hematocrit? Now in blood we have cellular element and we have plasma. So if we separate them, so if we centrifuge the blood, which is anticoagulated blood, then we get a packed volume at the base, and that packed volume is called as hematocrit or PCV. So it is the cellular component of the blood, and that is around 45% in females and 42% in females and 45% in males. So the formed cellular element of the blood is called as the hematocrit, and the remaining part will be the plasma. Now these are the PCV, and these values are very important. So when you will start doing the practicals on hematology, then you will come to know how to use these values for diagnosis and on prognosis of the patients. Now what is hemoglobin? It is a hemoglobin, the function of hemoglobin is to carry oxygen, and it is present in the RBCs. So we will see it in detail, what is the structure of hemoglobin and how it carries oxygen, but in brief it is composed of 4 globin chains, either 2 alpha, 2 beta, 2 alpha, 2 delta, or 2 alpha, 2 gamma. So there are 4 globin chains and there are 4 heme groups, and the heme group carries iron in the ferrous form, and each molecule of hemoglobin will carry 4 molecules of oxygen. So it is very important to know that each molecule of hemoglobin will carry 4 molecules of oxygen, and when oxygen binds with hemoglobin, then it is called as oxyhemoglobin, and when it detaches from hemoglobin, then that hemoglobin is called as reduced hemoglobin. And hemoglobin also combines with CO2 and transport it from the tissues to the lungs for its removal to the environment. Now there are WBC. So you know what is RBC, what is hemoglobin. Now the next element, the cellular element, is the white blood cells. Now white blood cells, they have nuclei, but they do not contain the hemoglobin, because their function is not to carry hemoglobin. They have some different specific function. So they have the nuclei, their typical concentration is 4000 to 11000 per cubic millimeter. So this is for healthy people. If you have any infection, suppose you have bacterial infection or viral infection, then that count will become higher. So whenever we feel ill, if you go to any physician, if you have fever, then the most important investigation which is performed is hemogram. In hemogram you have hemoglobin, then WBC count, differential counting. Okay, in WBC count we do एक तो total leukocyte count, that will be in the range of 4000 to 11000 if you are healthy. And in differential count, what is the meaning of differential count? That means how much percentage of different types of cells are present. So we count 100 cells, and from that 100 cell, what is the percentage of different cells? So that is called as differential counting. So WBCs are structurally or based upon the presence or absence of granules. They are divided into 2 types: granular WBCs and granular cells and agranular cells. Now granular cells are of 3 types: neutrophils, eosinophils and basophils. So the most common cells which are visible in the peripheral blood is a neutrophil. So their percentage is around 50 to 70%. The least common are eosinophils. Their percentage is 1 to 4%, and similarly basophils also have percentage around 1%. But if you have any allergic conditions or any helminthic infection or मतलब parasitic infection, then your eosinophil count will become higher. Or if you have any allergy मतलब asthma, and in all these conditions you will have the higher eosinophil count. Now agranular or non-granular WBCs are lymphocytes and monocytes. Now the lymphocytes again structurally divided into two types, small lymphocytes and large lymphocytes. So lymphocytes are divided either structurally or functionally. Structurally we divide into large and small based on their diameter, and functionally we divide them into T lymphocyte and B lymphocyte. So what is the difference? So the T lymphocytes are involved in cellular immunity and B lymphocytes are involved in humoral immunity. So we will go into details during subsequent lectures. So till then you just remember that lymphocyte, there are two types of lymphocytes based on the structure and function. And there are monocytes. So monocytes are important cells for immunity, as they are involved in phagocytosis and inflammation, and there are different types. Monocytes get converted into macrophages, which are important for phagocytosis. So we will see in detail about the functions during subsequent lectures. So these are the different types of WBCs. Now based upon their characteristic we identify them. So the first one from the left side is a lymphocyte. So it is a small cell having diameter of 10 to 12 micrometer. Now how, while looking the peripheral blood smear, why it is not always possible to measure the diameter of the cell. Okay. So in the peripheral blood smear we have RBCs along with WBCs. So if you see this picture, so we have abundant RBCs, and along with these RBCs we have WBCs interspersed between the RBCs. So we know that the diameter of RBC is around 7.5 micron. So we take the reference of this RBC and then we see what is the diameter of WBCs. So it is then we compare with the RBCs and we say that diameter of it is a double size of RBC. So the diameter of lymphocyte is around 10 to 12 micron. Okay, and it has a round nucleus in the center, and at the periphery there is a cytoplasm. Now the largest cell is a monocyte, and it has the diameter of monocyte is around 14 to 18 micron. It has a concave, and it has a large nucleus with a concavity, and it has a abundant cytoplasm also, and both these lymphocytes and monocytes are granular cells. Now we have granular cells, and these are eosinophils, basophils and neutrophils. So eosinophils, they have brick red granules. So we identify them by the presence of their brick red granules, and the granules are so dense that nucleus is also sometimes not visible. Now the basophils also have large number of granules inside their cytoplasm, and the color of granule is blue, dark blue colored granules are present. So now how these cells identify. And neutrophils, they have multi-lobe nucleus. The nucleus has around 5 to 6 lobes, and the granules are very fine and pinkish in color. So depending upon how the nucleus looks and what is the number of granules and how dense they are present, their color, we can identify the different cells in the peripheral blood smear. And then we count these cells. We count 100 cells, and out of 100, how many cells are present, how many cells are neutrophils, how many are eosinophils, how many are basophils. Depending upon the number, we calculate the percentage. Now what is the function of WBCs? So the primary function of neutrophils is phagocytosis. So they phagocytose, that is they engulf. What is the meaning of phagocytosis? So they engulf the bacteria and cause breakdown of the bacteria as well as cellular debris. So they kill the bacteria and they play very important role in immunity and inflammation. Now what is immunity, what is inflammation, we will discuss subsequently. Now what is the role of eosinophils? They help to break down blood clots and they also kill the parasites. So if we have the parasitic infection, then the eosinophil count is always higher. So because the role of eosinophil is to kill parasites. Now the role of basophil is they are also involved in immunity and they synthesize and store histamine and heparin, and histamine plays very important role during inflammation, during allergy, and heparin acts as the anticoagulant. Now monocytes are the very important phagocyte. They play very important role in phagocytosis, and when they reach to the tissue they are converted into macrophage. So there are certain changes which will take place in the monocyte and they become the strong phagocytic cell, and they play very important role at tissue level. So depending upon where they are present, they are named. Like if they are present in the alveoli, in the lung, then they are called as alveolar macrophage. So based upon the place they are named and they play very important role in immunity. Like alveolar macrophage will phagocytose whatever we inhale, means either it is dust particles or bacteria, virus, whatever goes into the lungs, that will be phagocytosed by the alveolar macrophage. So they play very important role in immunity. Now lymphocytes, so I have already told you they play very important role in either cell mediated immunity or cellular immunity or humoral immunity. In cellular immunity, cells themselves are cytotoxic cells, and they kill the bacteria, and in humoral immunity they produce antibodies, and then antibodies will act against the bacteria. So we will see it in detail during subsequent lectures. Now what is the third element in the blood is the platelet. So the platelets are formed in the bone marrow from megakaryocytes. They don't have any nucleus and they can secrete a variety of substances, and they can also contract. So they are basically involved in the formation of blood clot, okay, blood clot or thrombus, and they by formation of the blood clot they prevent the blood loss. So normal concentration is in blood is around 2.5 lakhs per or 1.5 to 4 lakhs per microliter, and they remain functional for 7 to 10 days, and they play a very important role in hemostasis. So let us see about now what is plasma or serum. Now I hope that till now you are with me and you know what are the cellular elements in blood and what is their function. Okay, so are you hearing me? Anyone can unmute?
Yes, ma'am.
So any difficulty?
Yes, ma'am. Yes, ma'am.
Do you have any question till now?
No, ma'am.
Yes. Anybody having any question or any difficulty? Huh?
Dead WBCs and platelets are also discarded in the spleen, right?
Yes, not only spleen, macrophages and all neutrophils, all they function to remove the dead cells. They cause phagocytosis. Neutrophils are also involved and macrophages are also involved. So it is not that easy that we मतलब ऐसे नहीं बोल सकते कि spleen में ही हो रहा है. It will happen everywhere. So mostly, but RBCs will be destroyed in the spleen. Old RBCs will be destroyed in the spleen, and then they will be phagocytosed. Okay, what is packed cell volume? So you want to ask what is packed cell volume? So when okay, ठीक है. So now we will proceed further. So what is plasma and what is serum? What is hemostasis? Hemostasis is stoppage of blood. Hem means blood and stasis means stop. So stoppage of blood is hemostasis, and we have a full lecture on this topic. So we will discuss it during that lecture. Now whenever we do the okay, so when we give our blood for testing, so either take the plasma or they derive the serum from our blood and do various tests. Have you heard of plasma and serum? Have you heard of this? Plasma and serum. Okay. Okay. Now what is plasma? It is a cell-free fluid matrix of the blood obtained after centrifugation of anticoagulant treated blood. So when we draw your blood, it is very important to immediately anticoagulate it. Now why it is important? Because otherwise, whenever the blood will come in contact with any other foreign substance like test tube or needle and syringe, if it comes in contact with this surface, it will form the blood clot. Okay. Now it is very important to prevent that clot formation if we need the plasma. Now to prevent it, what we do, we add the chelating agents like calcium chelating agents like EDTA. So because the calcium is very important in the formation of clot, if we cause chelation of calcium, then if we chelate it, then it will not take part into coagulation and the blood will remain in the fluid form. So that is called as anticoagulant treated blood. Now if we centrifuge this anticoagulant treated blood, then we get a portion of yellow fluid which is present above in the test tube. Okay, and that fluid or that cell free fluid matrix is called as the plasma. If we don't treat it with anticoagulant, suppose we take blood in a plain test tube. Now what will happen? Because it comes in contact with the test tube, it will form the clot. Now after around half an hour, that clot will contract and some fluid will be expressed out of that clot, and that fluid is called as the serum. Now while the serum is formed, all the coagulation factors which are present in the blood, they will be utilized. So these coagulation factors are fibrinogen, factor 2, factor 5, 7, and so all these factors will get utilized during the formation of clot. So serum will not have these factors. So the main difference between plasma and serum is serum will not have the clotting factors, while plasma will have the clotting factors. So this is the most commonly asked question in your viva. Okay, either your practical viva or grand viva. So what is the difference between serum and plasma? So plasma will have all the clotting factors, all the proteins, and as in serum, during the formation of serum, the clot has already formed. So during the formation of that clot, all the clotting factors will get utilized. So serum will not have any clotting factor. Okay, and there are different tests which will be performed on either plasma or serum. So based on what you want to measure in your blood, you have to collect blood in either your EDTA tube or plain bulb. Okay, so EDTA tube means it will have EDTA in it, and if you collect blood in that tube, then the blood will not form the clot. If you collect the blood in a plain test tube, then it will form the clot and the serum will come out. So this is the main difference between plasma and serum. So what are the constituents of plasma? So it contains solid factors like out of solid elements, and these are again divided into organic and inorganic. That is, organic are amino acids, carbohydrates, fats, and secretions, enzymes and antibodies. And inorganic constituents are sodium chloride, potassium, calcium, bicarbonate, iron, copper, iodine. So all these salts and which are dissolved in the plasma. Now the gases are oxygen, carbon dioxide and nitrogen. These are the main gases present in the plasma. So we have seen that plasma has so here you have seen that plasma has amino acids, carbohydrates, fats and secretions, enzymes, antibodies. So these secretions, enzymes, antibodies, amino acids, so they all are proteins. So the main important component of plasma is plasma proteins, and there are various types of plasma proteins, and they are broadly divided into albumin, globulin and fibrinogen. So albumin, the function of albumin is to provide colloid osmotic pressure. The function of globulin is it acts as either enzyme, so it has enzymatic function. It has a role in immunity, because the gamma globulins are the mostly antibodies. So antibodies, there are IgG, IgM, okay, there are different types of antibodies we will see, and these are all gamma globulins. So globulins take part in immunity, and there are enzymes also which are globulin. And fibrinogen, now fibrinogen is important for the formation of blood clot. So we have fibrin which gets polymerized and they form the fibrinogen, and it gets polymerized to form fibrin threads, and which is involved in the formation of blood clot and in hemostasis. Now what is the site of synthesis of this plasma protein? So it is the albumin and fibrinogen is almost 100% formed in the liver, while globulin is formed 50 to 80% is formed in liver, and the remaining will be formed in the lymphoid tissue. Means the antibodies are all formed in the lymphoid tissue. So now what is the role of this liver? So if there is any disease condition, that is if there is any liver cirrhosis or if any malignancy in which the liver function is affected, now what will happen to the plasma proteins? So can you guess what will happen to plasma proteins if liver function is affected? Because albumin and fibrinogen, they are mostly synthesized in the liver. So what will happen if liver function is affected? They will be less formed. Yes. Yes. So their concentration in the plasma will decrease. So the main function of albumin we have seen is to provide colloid osmotic pressure. No, so do you know what is colloid osmotic pressure? Very nice, Archit. Okay, so the plasma proteins are mostly the albumin, okay, because the molecular weight of albumin is less and the number is more. So the number of that albumin will determine how much osmotic pressure will be provided by that protein, okay. So and its molecular weight is less. So the albumin is a very important protein which will provide the colloid osmotic pressure in the plasma, and the main important function of colloid osmotic pressure is it will keep the water inside the blood vessel. So it will not So the water will remain inside the circulation. Okay, so if the concentration of albumin decreases in liver cirrhosis or in protein energy malnutrition, there is a specific deficiency of proteins. Okay, it is observed in children. So protein level is very less inside the plasma, so colloid osmotic pressure is very less. So what will happen? So the water will move out of the vascular compartment and it will lead to edema, ascites. So ascites is collection of large amount of water in the abdomen, okay, in the peritoneal cavity. So it will lead to ascites, it will lead to edema and all other complications. So it is very important, and if the liver function is affected, then bleeding time will also increase. Bleeding time, clotting time all get deranged if the liver function is affected. Okay, so this is the importance of albumin and liver in the synthesis of plasma proteins. So these are the some plasma proteins. Like albumin, we already know it is also involved in binding and carrier of other proteins or hormones. It is also osmotic regulator. Then alpha 1 antiproteases, alpha 1 phytoprotein, alpha 2 macroglobulin. So there are so many. So this is a small list, and there are so many different proteins are available with different functions. So we have ceruloplasmin, which will transport copper. We also have transferrin, which will transport iron. So the function of proteins is osmotic regulation. Then it will play important role in immunity. They are important in transport to transport the hormones or lipid soluble hormones, means all these to transport them. It is very important to have the proteins in the circulation. So in which condition will we will have decreased level of plasma proteins? So mostly, so if there is a severe burns, so what will happen in severe burn? So there will be the skin will be lost or denuded areas will be there, and from that the proteins or the plasma will ooze out, and it will lead to loss of plasma proteins and plasma in patients having severe burns. So in that case we have to give proteins to the patient. Then in renal disease, now in the like nephrotic syndrome, so you will learn in renal system that the function of kidney is to remove the water soluble waste from the body. So how the kidneys perform this function? First stage in the formation of urine is filtration. So in the glomerulus where filtration of blood takes place in the glomerulus, and in the glomerulus the arrangement of capillaries or the filtration barrier is such like it will not lead to filtration of proteins because it has negative charge and it has small pores. So it will prevent filtration of plasma proteins. But if there is any renal condition in which either this barrier function is affected, if there is loss of negative charge on that barrier, then it will allow plasma proteins or specifically albumin also to filter, and it will so the large amount of proteins will be filtered in the urine, filtered, and it will come out through the urine. So in renal disease also we will have decreased level of plasma proteins. In liver disease we have already discussed. In cirrhosis of liver there is fibrosis, formation of fibrosis in the liver. So that fibrous tissue will affect the normal functioning of liver, and it will lead to decreased level of plasma protein. Prolonged starvation, so we have discussed that is if you have specifically protein energy malnutrition, then the level of these proteins, plasma proteins will decrease. In malabsorption syndromes, in which reabsorption of amino acid is affected, if there is then it will again lead to decreased level of plasma protein, and afibrinogenemia is a condition in which specifically fibrinogen level will be decreased. Okay. So what are the functions of plasma proteins? So we have already discussed, that is colloid osmotic pressure. So the normal value of plasma colloid osmotic pressure is 28 millimeter of mercury. So you have to remember some values, and out of that value is this colloid osmotic pressure of the plasma. So it is 28 millimeter of mercury, and out of this 28 millimeter of mercury, 19 millimeter of mercury is by the albumin, and remaining 9 millimeter of mercury is because of the Gibbs-Donan effect. So Gibbs-Donan effect means now which substances can provide the osmotic pressure. Suppose there is a semi-permeable membrane. Okay. If we have a semi-permeable membrane, then the substances which cannot cross the membrane, they will provide the osmotic pressure. Okay. So proteins cannot cross the semi-permeable membrane, so they will not they will provide the osmotic pressure. And as the proteins cannot pass through the semi-permeable membrane, along with that protein, because the proteins have the negative charge, and because of that negative charge, the sodium and potassium, the excess of sodium and potassium will remain inside the circulation, and they will provide some colloid osmotic pressure. Okay. So the total colloid osmotic pressure provided by the albumin is around, by plasma proteins and more specifically by albumin, is around 28 millimeter of mercury. Now the next function of plasma protein is carrier proteins. So they carry various various factors, like albumin will carry steroid hormones, fatty acids, then sex hormone, fatty acids, then there is sex hormone binding globulins which will carry estrogen or testosterone. Then there are corticosteroid binding globulin which will carry corticosteroids, then thyroxine binding globulin. So that means the albumin and globulin, they act as the carrier proteins also. Now why it is important to have carrier protein? Because these are the lipid soluble substances like corticosteroid, thyroxine, they can cross the cell plasma membrane. So if they remain free in the circulation, they will go inside the cell. Okay. So to prevent that, so we have to maintain the equilibrium between the binded the portion which is binding with the proteins and the free portion. So there will be some free portion also, and there is always an equilibrium between the free portion and the portion which is bound to the carrier proteins. So the carrier proteins also, so the proteins also act as a carrier for different hormones. Okay, like steroid hormones, sex hormones, then corticosteroids, thyroxines. So they carry the hormones in the plasma. Now they also act as a source of amino acid during, suppose you have the injury, and for the healing purpose we need proteins or amino acid. So the amino acid which are present in the plasma, they will act as the source for the they act as the building blocks for the formation of the tissue protein. So so they act as a reservoir for proteins. Then reversible, so because of this reversible equilibrium between tissue and plasma proteins, if you have any injury, if the tissue requires more proteins, then at that time the amino acids will be taken from the circulation or from blood, and the proteins will be synthesized by the tissue. Now blood coagulation we have already seen that is there are different coagulation factors which are nothing but proteins, and whenever there is any tissue injury, then these proteins will come into play and they form the blood clot to prevent the blood loss. So proteins, the one of the important function of protein is to form in blood coagulation. Now they are also important to provide immunity or body defense, like we have already seen, that is B lymphocytes are there which will form the antibodies, and there are also biomarkers which are some proteins, and they are involved in providing immunity to provide the defense against microorganisms. Now they are important for acid base regulation also. You will see in detail during the renal lectures, that is how the proteins act as a buffer in maintenance of acid base regulation. Now maintenance of blood viscosity is also very important, and they provide the suspension stability to RBCs. So you should be able to enlist all these functions of plasma proteins. So if I ask you what are the functions of plasma proteins, so you should be able to tell me at least 7-8 functions of plasma proteins. So they are involved in they provide the osmotic pressure, they are the transporters, then they are involved in blood coagulation, they are involved in immunity, acid base regulation, then they provide viscosity to the blood. So these are all important functions performed by the plasma proteins. Now what is plasmapheresis? So till now we have seen that the immunity is provided by the plasma proteins in the form of antibodies. So if you have any autoimmune disease, suppose you have any antibodies which are against your neuromuscular junction receptor, means there are receptors for acetylcholine at neuromuscular junction, and you have the antibodies against them, okay, or you have the antibodies against your thyroid. So if you have any autoimmune condition, then it is important to remove these antibodies which are acting against your body, okay. So what we will do in this case, then we do plasmapheresis. Now what is plasmapheresis? We take out the blood continuously from the patient, and after once the blood comes out of the body, then we separate the plasma and cells. The plasma which has high amount of autoantibodies, it will be removed, and the RBCs will be resuspended into fresh saline, also sterile plasma and other cells, and then it will be reinfused. So this is called as plasmapheresis, and plasmapheresis is used whenever you have autoimmune disease with high concentration of autoantibodies, okay. So that this procedure is called as plasmapheresis. Now this is the quiz question for you. So till now, is there any query? You can unmute and you can ask question.
Can you tell more about the suspension stability of RBCs by proteins?
Okay, that we will see in detail during the subsequent lectures. Because suppose you have the RBCs and you suspend it in water, and if you suspend it in the plasma, okay, so then in which conditions the RBCs will be more stable? Suppose you compare with the water and plasma, and you take RBC and suspend it, in which solution it will be more stable? What do you think?
Plasma.
Okay, because the plasma has the viscosity, okay, and this viscosity will help to stabilize the RBCs in the circulation, and also RBCs have negative charge, that is also called as theta charge over the surface, and because of this negative charge they will repel each other, so they will not form the packed mass or they will not come in close contact with each other because they have the negative charge, and they because of which they can remain separated and well suspended in the plasma.
Excuse me.
Huh?
How severe burns lead to decrease of plasma proteins?
What? Can you repeat?
There was a severe burns lead to decrease
Okay,
of plasma
severe burns.
proteins.
Okay, so whenever there is severe burn, so mostly we lose the skin. Okay, and skin is lost, and the capillaries are open, and they will be oozing of the plasma from the that blood vessel or capillaries. Okay, and because of that loss of plasma, we lose proteins also. That is called a denudation in the burns. So because we lost the plasma, we lose plasma proteins also.
Okay, thank you. How plasma collections will prevent autoimmune disorder, or
It will not prevent autoimmune disorders. Okay, it is only to decrease the level of autoantibodies inside the body. Do you know any celebrity which has autoimmune disease?
Amitabh Bachchan?
What he has?
Myasthenia gravis.
Okay, so in myasthenia gravis there is we have autoantibodies against acetylcholine receptors at neuromuscular junction. So if the titer of autoantibodies is very high, then this is only for short, it will help only for short duration. The long term treatment will be immunosuppressants and other treatment we have to give. It will help only for short period. Okay. Okay. Now for you we have one quiz question, that is, next time you will tell me, so which component of blood is used for assessing the levels of glucose, sodium, calcium, proteins, hemoglobin, pH, RBC count, liver function test, thyroid hormone levels and potassium. Okay, so which component of blood means either we use whole blood or serum or plasma. ठीक है, understood? So suppose for RBC count what we will use?
Whole blood.
Yes. Okay.
Whole blood.
Yes, very good. So for RBC count you will use whole blood. Like this, you would next time you will tell me what you will use for glucose to potassium. Okay.
Yes, ma'am.
So how you are so you are having lectures from morning till evening?
Yes, ma'am. Yes, ma'am.
Are you enjoying?
Oh, ma'am. No, ma'am.
So you want to come to AIIMS, huh?
Ma'am. Yes, ma'am. Yes, ma'am.
Okay,
Yes, ma'am.
hopefully we will see you soon. Okay, till now take care, and you which book you are using for reading for physiology?
Ma'am, Gaitan.
Okay,
What is your question?
acha, Canon also you are reading, very good.
Ma'am, which book do you suggest?
For blood, Gaitan is good. For Ganong, you have to read Gaitan first. It will take some time to understand, but Ganong is also very good. ठीक है? So I think now the time is up. So all the best and start reading. Okay, you will not get time once you come to AIIMS. So till now you have to read whatever we are covering in these lectures. ठीक है?
Fine, ma'am. Thank you. Thank you so much.
Okay. Thank you. Bye bye. Bye.
ये कैमरा नहीं चल रहा।
कैमरा अभी मैंने ऑफ किया। माइक भी ऑन है।
थैंक यू।
Good afternoon, everyone. If I am audible and visible, let me give me a little input. Good afternoon, everyone.
Yes, sir, you are audible.
If I am audible and visible. Right. So now we begin with hardcore physiology. In the morning, I give you a little more philosophical views regarding what physiology is and how do we approach this subject in context of patients and their treatment. And now I will cover in next 1 hour a topic which is so implicit in practice of medicine that we don't even perhaps recognize that everyday practice what we are doing is nothing but doing homeostasis management. This is a topic which will be repeatedly asked to you by your examiners, and is expected that you understand these topics very well. So let me start with your job that you're going to do as doctors. So as doctors, you would be required to make these decisions. Decisions when you see a person, a patient, you have to make a decision whether the person is living or person is dead. You may also be required to make decisions in a living person whether a person is normal or diseased, or whether the patient requires your intervention or you will let nature take its own. And these are decisions that we have to take as doctors. So from medical perspective, when you see a person, either the person is living or the person is dead, and the only exception being the Schrodinger's cat, which can be living and dead at the same time. But we don't have this kind of luxury for medical doctors. We have to say whether the person is living or dead. And how do we make that decision? So there are medical legal criteria that we have to follow in medical practice, when to call somebody dead and when to call somebody living. There is a physiological view which I will share with you. There are philosophical views, there are spiritual which I won't be sharing with you. I'll be looking at the physiological view of what it means to be dead and what it means to be living. Medical legal criteria you can read up later, or you'll be taught in later classes in second, third year. So from physiological viewpoint, an irreversible loss of integrated functionality would one call as being dead. Because if you see, even when the person is dead, the organs are alive. That's why we can do organ transplant. We can give somebody's heart, and the heart keeps on beating in somebody else. We can transplant a kidney, the kidney works fine in somebody else. It can be live donor, but we also have posthumously from post-death, you can transplant these organs and they function pretty well. So what it means to be dead as far as physiology is concerned, that the person as a whole, as an integrated personality, is no more existing, and it is irreversible loss. In the living, you have healthy conditions and you have the disease condition, and as a doctor, large amount of your life will be looking at patients and classifying them as, okay, now you got A disease or a B disease, and you intervene. This distinction again requires clinical acumen, laboratory reports, investigations and all. So what are these integrated functionality mean? So this integrated functionality, which basically means that all your organ systems are working together as one whole in an integrated manner, and this stable balance is disturbed by internal factors and external factors. And this particular idea of constancy of internal environment of the body was given by Bernard in 1878, and it seems a very simple idea when we think of it today. This makes sense, but at that point in time, it sort of created a paradigm shift in the way we looked at life. So what he told was that it is the fixity of milieu interior which is conditioned for free and independent life. All the vital mechanisms, however varied they may be, have only one object, that of preserving constant condition of life in internal environment. So this transition between healthy and disease state is effectively what? So there is a clinical view. The clinical way a doctor will look at, you as a doctor will see a patient, examine the patient and say, oh, you need a treatment. Or you would refer to a laboratory investigation, the lab report comes, the liver functions are abnormal. You say, oh, okay, you need a treatment, you are now diseased. There's a disease process going on in your body. From physiological perspective, a healthy state is one in which the internal environment is within specific range. you as a person internally are stable and all the parameters are within a specific range. A disease state from physiological perspective would be when these internal environment and their parameters are beyond specific range. So you have your temperatures, they are within a limit, we say you are physiologically healthy, you're a healthy person. It goes beyond a certain limit, we will call you diseased. You have your hemoglobins, you have your pH, no matter what parameter that you look at, blood pressure, within a limited range, you're healthy. Goes beyond a limited range, we call you diseased. So all our endeavor as a medical practitioner is to bring back a person from a disease state to a healthy state, effectively bringing the whole internal environment back to its stable conditions, and which can preserve constancy of life. And these processes by which even a healthy person undergoes these processes, physiological processes, which keep the internal environment stable and balanced, and all these things are. There was some message, I don't know what that message was. Let me check that message. Oh, that's okay, Robin. Robin, no issues. If the kids want to chat, let them chat. We are not here to control them. It's up to them. Right. So back to homeostasis. So homeostasis is all those processes occurring in a human body, occurring in all animals, in plants, all life forms, which keep the internal conditions stable and balanced for a consistency or constancy to maintain those parameters so the life can continue. Okay. And in the beginning I told you about that this understanding will be extremely helpful for a medical practice. Let me elaborate upon it. So when you ask yourself or you look around and say this doctor is a good doctor, what makes a person a good doctor, a competent doctor? So a doctor must be able to identify a disease state from a healthy state, because if you're not able to do this, either you will initiate treatments when they're not required, or when it's required you won't initiate a treatment. Number one, this distinction is extremely important. Second, you know about, once you've identified a disease process which is going, you know the medical surgical interventions that are available for a particular disease state. Many times we are able to cure the problem, many times we are not able to cure the problem, but we have interventions which can help to maintain the stable internal environment. For example, you take COVID disease today. We really don't have a treatment for COVID disease. But what are we doing when we are giving a medical treatment? The oxygen levels are low, we provide oxygen. The inflammatory markers are high, we provide some intervention where the inflammatory markers can go down. So in a way, even though we are not treating the disease, what we're trying to do is maintain the stable internal environment so that the person has a kind of time where the disease process, the virus does its job and the person is still alive at the end of it. Even if you know about this, you have to still be able to deliver that knowledge, implement that knowledge. That's why it's all about skills. Knowing that I have to give oxygen to the patient of COVID is of no use if you do not know how to give it. If medicine is not something that you read, memorize and be happy about it, you have to be able to deliver it. If you know everything about an antibiotic but you don't know how to give an injection, all that knowledge is useless as far as medical practice is concerned. So you have the skill set, and it is these skill set that we hope that you will acquire in next 4.5 to 5 years and later all your life. And with this skill set, you treat, if possible, the disorder, the disease, and if not possible, you manage the disease so the internal environment is stable. This is what a good doctor does, a competent doctor does. Let me tell you about, in my understanding, what a great doctor would be. A great doctor would be who does all these things. Who knows how to identify when there is a problem, knows about what to be done, has a skill set to implement it, and then is able to manage the disease. So a great doctor would be the one who has all these above abilities and tunes the medical surgical intervention to sync with the ongoing internal homeostatic processes. Because even without you, in a disease process, your homeostatic mechanisms are countering the problem. They are. So whether it's diabetes, whether it's hypertension, no matter what disease you take, the disease manifests because the internal processes are not able to match up with it. But they are still trying to. And if you are a competent and wise doctor, you will understand those processes and tune your medical and surgical intervention such that you help the ongoing process, not counter it. And you view disease process in the context of whole human body and treats the whole individual. Now this has been a trouble with specialization and super specialization and even super duper specializations. And I think the model which is practiced in United Kingdom of the general practitioner being the core person who treats the patient and invokes the services of super specialists to help the patient is perhaps the best model, or the concept of family doctor, because you have to not only see the person but see the person in the physiological, in a way, yes, it's a holistic approach, but holistic in the sense of the person, family, context, the background, then you are able to handle all components of the disease. So let us say somebody comes with gallstones, and as a clinician you just remove the gallbladder and take care of it. You may have taken care of the gallstones, but perhaps you have not taken care of what is the reason why the person had gallstones. What will happen if you remove gallstones? What dietary advices will have to be given? Is this person having a family who also have gallstones, or is the environment in which the person is living is contributing to occurrence of gallstones? As a competent and a wise, great doctor, you would not only get the treatment of the gallstones, but also look at the whole composition of it, and in a way get into what is called as the preventives in social medicine in all its perspectives. So the word holistic in that sense can be applied to it, but unfortunately holistic also goes beyond the traditional medical sciences and invokes non-proven methodologies and data. Therefore, I would be a little cautious in calling it holistic medicine for its connotations. But otherwise, conceptually, yes. A great doctor would be able to do not only give the medication, but also look at the processes occurring in a human being, in the family, in the larger society, and then be able to treat not only the particular organ system, but whole human as a whole. And if you look at the definitions of health, whether it's WHO, it speaks of all these factors. All right. So little coming back to the concept of homeostasis, Aquinas. So this particular terminology, like before Walter Cannon, I spoke to you about a guy called Claude Bernard. So Claude Bernard gave the idea that the internal environment must be constant for a healthy life. Cannon elaborated further upon it, and he looked at various processes that maintain it. Okay, and he called all these processes as the process of homeostasis. And this is an interesting or other landmark paper available online. You can check it up. Physiological Reviews is one of very important source of information for all physiologists and clinicians alike. And he chose this word homeostasis, and it's interesting to read why did he shift. He was looking at, should I use the word equilibrium or should I use the word homeostasis, and he somehow used the word homeostasis for the thing that, stasis means something set, immobile, stagnation, and here he uses a condition. Homo versus homeo. Homo means same, homeo means similar, and when he coined this terminology of homeostasis, he chose the word homeo and stasis, indicating all the processes by which the stable conditions are created. And it is a range of stable conditions. People have looked at this terminology and say it is not necessarily exactly stable. It is a range of stability. You could go on that, but as a concept, homeostasis basically means the processes by which a stable environment, internal environment of a body is maintained. Okay. So I'll request now you to pay a little attention. WhatsApp can wait if those who are doing WhatsApp chat. I'll give you an experiment to think about. Imagine you are required to walk in extremely hot temperature without shade, and you lose a lot of water due to sweating, breathing over a few hours. As a result, amount of water in your body decreases and concentration of electrolyte also increases because of selective loss of water and less loss of salt. So what would be your behavioral response to this situation to restore internal environment? Internal environment has been disrupted by external environment and you need to bring it back. What will the animal do? What would you do? If you could give me some answers, just type it out. Absolutely, lovely. So thirst, drinking water, and you would be thinking what kind of simple question was this? The question is simple, but you will be surprised at how about 40% of people, even in residential areas, do suffer from dehydration despite very strong mechanisms. Okay, so as all of you pointed out, drinking water is the solution to it. So all the processes, including the mechanism by which sensors in your body detected decrease in volume of water, detected increase in concentration of electrolytes, the mechanisms that made you feel thirsty, as someone pointed out, initiated behavioral response. Example of hemostasis, somebody mentioned ORS. Yes, of course, ORS is the medical treatment that you will give. Now, further questions. How much water do you drink when you are thirsty? In how much time the feeling of thirst disappears? In how much time is required for absorption of water? In how much time body water and concentration of electrolytes be restored? Guesses? Experience wise? 2 glasses. Lovely. So the question next comes, as a physiologist, what mechanisms quantify these 2 glasses? What mechanisms are able to do these volume calculations till the thirst goes away? The thirst goes away almost instantly. The moment you drink water, in few seconds the thirst is off. Dryness of mouth. In how much time will the water be absorbed? Okay. How much time will it take for absorption of water and the original problem to be restored? Few minutes at least? 5 minutes at least. Let us say 5-10 minutes. But do you drink for 15 minutes or 5 minutes continuously? We don't. We drink in few seconds. That means you have mechanisms in your body which are able to predict amount of water required. You drink it, it gives you the feeling of thirst is taken off, and over 5-10 minutes, if the amount of water you took was sufficient to restore the total body water and concentration of electrolytes, you don't feel thirsty again. If not, you will again feel thirsty, and the same mechanism keep on happening. So here you have 2 mechanisms. One mechanism which senses the problem and does a corrective measure. A second mechanism which predicts the possible changes because of your behavior. And it is these combinations of processes, and I will use certain terminologies later, what we call as a feedback mechanisms and feed forward mechanisms. So the mechanism which detected the problem and made you drink could be called as the feedback mechanism, and the mechanism which quantified the amount of water that you drank and postulated that, okay, this is the amount of water which is sufficient for restoration of electrolyte balance, would be called as feed forward mechanisms. Okay, so back to the idea we were discussing, the milieu interior, what was spoken by Claude Bernard, that the internal environment has to be kept constant. As a doctor, if I asked you, can you look at a person and tell me whether the person's internal environment is okay? What are you going to measure? How are you going to quantify it? So internal environment is characterized by measurable parameters. I will come to the feed forward mechanism again. I will come to that. So let's go back to first this. If I asked you, a patient is lying in front of you, somebody came to your OPD, and you have to now evaluate whether the person's internal environment is okay. Is it within the stable parameters? So usually what we did was we would take the person's pulse rate, temperature, breathing rate, what we normally call as, yes, thermometer for temperature, and we try to gauge. These are what we call as vital signs, and very commonly you will use, where you will be doing this in wards. Every 4 hours you take temperature, pressure, pulse rate, respiration rate, what we call TPR BP, temperature, pulse, respiration and blood pressure. You will keep doing it. This is what we can call as a clinically you will do it. At the same time, the technology has given other tools as well. You could take a blood sample, you could measure their osmolality, you could measure their pH, blood glucose level, blood cholesterol level, liver function test, kidney function test. A huge array of investigations you can do to characterize internal environment. And whenever you see that, okay, this person's pH is changed, you will initiate a measure. You see the blood glucose levels are not stable, very high, very low, you will initiate a measure. So effectively, most of the investigation that you do, even for that matter, you look at the PO2 levels. So today the whole community is having COVID. What are we going to do when a person comes? Should I initiate treatment? We tell, okay, measure somebody's SpO2, oxygen saturation, measure somebody's pH. So all our investigations that we do in any patient largely would be characterizing internal environment, along with, of course, the functionality of individual organ system as well. So I may be looking at liver function test also separately. I may be looking at function of heart separately. But at the same time, at the background, you will always be evaluating somebody's internal environment. Okay? So the list is long. More you know, more technology you have, more investigations you do. Even when there is no technology with you, you will do basically take somebody's temperature with thermometer. Today I will do SpO2 because the COVID situation is around. So any person who is feverish, I will rather take measure SpO2 to understand their the stability of internal environment. If the SpO2 is dropping, I understand that the systems are not able to manage it, and then I will initiate treatment measures to bring the oxygen saturation back to the normal. Now, this is what we are doing primarily in treatment of COVID today. Now, these variables that I spoke of, total body water, osmolality, pH, body temperature, glucose, these are what we can call as the variables to characterize an internal environment, and they are no different from any other variable that you have studied in 11th and 12th standards. Now, two terminologies I will request you to pay attention to: regulated variables and controlled variables. A word of caution here, that these terminologies are not spoken of in most of the textbooks and most of the scientific literature, unfortunately, about the internal environment in physiology. I do not know the reason why it has not been given its due attention. However, if you read the publication by Cannon, one who introduced the term homeostasis, and later by a couple of other authors, the two needs to be distinguished, and I will ask you to take you through this idea with an example of room air conditioning. Okay, so we have ACs in our homes to maintain even in the car to maintain temperature. So room air conditioning system maintains room temperature at a specified temperature by either cooling the air or by heating the air. The electronics of the machinery compares room temperature with the specified temperature, and accordingly either starts the compressor to cool the air or starts heater to warm the air. And we know all this. My question to you is this: what is being regulated and what is being controlled? Now, of course, these are English words, and I try to look at the English dictionary, Oxford, Cambridge. Not much differentiation they tend to use between what are regulations, what do you mean by to regulate, what do you mean by to control, and therefore I took umbrage in how Cannon described it. So if you follow what Walter Cannon spoke, if you read his paper, from his idea, what is being regulated is temperature, and what is being controlled is activity of compressor or the heater. Okay, let me repeat. What is being regulated is room temperature. What is being controlled is the activity of compressor or the heater. So the regulated variable is body temperature. All the mechanisms that the previous example I gave. So let me go back to that previous example. You drink water, you are thirsty. What is being regulated and what is being controlled? So what is being regulated is electrolyte concentration and total body water. What is being regulated is electrolyte concentration and total body water. What is being controlled is feeling of thirst. You go around, look for water. That, or later, as we will teach you later, there is release of hormones like antidiuretic hormones, angiotensin. All of them are attempting to bring the electrolyte concentration, osmolality back to normal. Therefore, all these mechanisms which are initiated to regulate electrolyte concentration would be called as controlled variables. Okay. So here I am giving the components of homeostatic process. The lowest one is osmolality, the regulated variable. The osmolality will be sensed by something called as osmoreceptors. I am not getting into the actual details of the process, the various, where are the osmoreceptors and how it's going, but the components of it. So there are osmoreceptors which will sense this particular change in the osmolality. It will be sent to neural centers or integrators, which will in a way compare with the set point. I will talk a little more about set point later. And then effectors will be initiated. So whether it could be a feeling of thirst like we saw in the example, or it could be release of antidiuretic hormone, it could be increased release of angiotensin 2 from kidney mechanisms of RAS, and behavioral effects. Is everybody with me on board on this?
Yes, sir.
Yeah, because see, the reason why I'm repeating this, because
Yes, sir.
thank you for messaging, because unfortunately this kind of deliberations are not not explicitly told in any of your textbooks, and I think it's something which you should be very clear about. Okay, so I'm just putting some components: a regulated variable, a variable that is maintained within specific range; a controlled variable, a variable that is controlled to maintain another variable in specific range; a sensor, a physical structure that can sense a regulated variable; afferent pathway, a physical structure. It could be a neuron, it could be a molecule which is released from a cell which goes somewhere, carried in the blood; an integrator, a physical structure which usually tends to be a neural structure, but you can have any other organ system which can act as an integrator; a set point. Now please note, in set point I write a hypothetical component. A hypothetical component that stores the value of the range of regulated variable. And this has been a little trouble with the understanding of physiology, because if I take the example of osmolality, we say that osmolality of blood must be maintained between 280 to 290 milliosmoles per liter, or the body temperature must be maintained between maintained around 37 degrees centigrades. Where is this information written? Because as per this particular diagram, which is again will be very commonly, you will see this diagram without the terminologies of regulated and controlled variable in most textbooks as an example of homeostasis. But if you ask a physiologist, a doctor, a biologist, can you tell me where is the value of normal range of temperature located? Where is it kept? The blood pressure has to be maintained between this range, 120, 80 plus or minus XYZ. Where is it located? Where is it present? Unfortunately, we have not been able to find this. Therefore, I write a hypothetical component. It seems to make good model, seems to make everything look nice, but as a biologist, as a physiologist, I would be a little worried. So somewhere subconsciously, in biology, unfortunately, we'll have to come back to what is subconsciousness and where is located. We still have to find somewhere, some mechanism, something has to be there. It could be a network, it could be a cell, it could be a population of cell, but there has to be somewhere this set point is stored. Unfortunately, as far as we're looking at homeostasis at the whole body level, we have nothing. And I will touch upon this particular idea a little later when we are finishing the lecture. So till that point, hold this thought. A hypothetical component. Efferent pathway, obviously, the pathways that make you drink, the action, gulping water, those are the efferent pathways. the mechanisms that cause release of antidiuretic hormone or release of angiotensin 2. They would be the efferent pathways. So I hope that this particular idea is with you, and you please go through this again and again, because the idea of regulated variable and controlled variable, and these two terminologies have been so interchangeably used. Even though Walter Cannon was very, very clear about what he wrote, and he used the word regulation, he never used the word controlled as far as homeostasis was concerned. But later, including Guyton, have used both the terms interchangeably. Sometimes he mentions control of cardiac output, sometimes he mentions regulation of cardiac output. So it's unfortunate, but that's how the discourse occurs. So I'm giving you this a new example. So I'm asking you to now fill in the components. You can type it in. So I have here an example of a homeostatic process which maintains blood pressure. The blood pressure, and when it decreases, it is sensed by baroreceptors in the aorta and in carotid arteries. It is carried by, that information is carried by cranial nerves, 9th and 10th. It reaches nucleus tractus solitarius. It integrates with other neurons over there. I'm not mentioning those. It is compared with so-called set point, and the system detects, oh, the blood pressure is now low, and therefore it initiates sympathetic and deactivates parasympathetic mechanism. There is decrease in the heart rate. There is vasodilatation, which all again restores the blood pressure. So in this example, what was being regulated? Heart rate or blood pressure?
Blood pressure.
Correct. So the blood pressure is a regulated variable. What is being controlled? Heart rate. So heart rate is the controlled variable. So as a physiologist, when I see a question which says, tell me the factors which regulate heart rate, I'm aghast. You don't regulate heart rate. You regulate blood pressure. You control heart rate to regulate blood pressure. Okay? But you will find such questions very often, because many of the physiologists and doctors use these terminologies interchangeably. I hope that you will not use them interchangeably, and you will use the terminologies where they are supposed to be used. Okay? So people have already mentioned sensors are the baroreceptors, afferent pathway. Afferent pathway. Somebody can type it out. Lovely. Integrator. Integrator with this particular diagram. Integrator in this particular diagram. Nuclei. Lovely. So of course, please mind you that for the sake of simplicity, I have written NTS, but it is a network of neuron, including NTS, which is a part of it, but also includes areas called as RVLM, CVLM, which you will be taught in your cardiovascular lectures. Lovely. So similarly, now my question is, where is set point? What is set point? Where is it? We don't know. Nobody knows. There is nothing, not perfect. It's hypothetical. It's hypothetical. It's hypothetical, because there is no region in the brain, either of rat, human, cat, no matter where the experiments are done, where value of BP is written to which it is compared. Okay, and the different pathways. I'm sure by that time you're pretty smart. All of you know. So homeostasis is essentially operating through negative feedback mechanism. Okay, a regulated variable gets altered by external or internal factors. A receptor senses this regulated variable. A processing unit detects an error, compares with hypothetical set point, initiates effector mechanism that corrects the error, and the variable gets back to being within the normal range. Homeostasis is achieved, milieu interior is restored. Okay. So for something, no. A question is there? Is it always negative? No, it is not. And I'll come to those other mechanisms within few minutes. But majorly, all major mechanisms of restoration of an altered internal environment would be negative feedback mechanism. So for a negative feedback mechanism to operate, the error must occur in the regulated variable, obviously. This effect should reverse the changes in regulated variable. Reverse. If you can't show this, then I can't say a negative feedback mechanism is operative. Okay. There are other mechanisms which are spoken of apart from negative. A positive feedback mechanism of homeostasis. Even though I have personal reservations about it being as a mechanism of homeostasis, but nevertheless I will speak to you about this, and I will leave it to your intelligence and your own wisdom to contemplate upon it. But it is generally mentioned in textbooks and everywhere as a mechanism of positive feedback. So let us say, what does it mean? A positive feedback mechanism, by its understanding, means that a change in variable leads to activation of mechanism that leads to further change in the variable. That means a positive feedback would be a counterintuitive thing. If my BP increased, something happened which further increased my BP. Oh, that doesn't make sense. But let us see how does it make sense and how people like to put it in a perspective. So let us see a perspective of positive feedback, which is normally spoken or in your textbooks, large number of them. Though personally, I don't think they qualify to be included as a part of homeostasis. But since I have to also tell you about other viewpoints, rather my own viewpoints, and I will leave to your intelligence and your wisdom to make a meaning out of it. So let's take this example of positive feedback. Platelets are activated on exposure to some endothelial collagen. So when you get injury, the endothelium is exposed. The activated platelets releases biomolecules that activate more platelets, which further activates more platelets. It's a positive feedback. So when a platelet gets activated, it causes activation of more and more platelets. Thus, once activation of platelet begins, it becomes an autonomous process that goes on and on and on till the supply of platelets is exhausted or some higher order mechanism stops it. Okay. So is this a negative feedback mechanism, or does it help in homeostasis? Let us see how you can example correctly. Somebody mentioning parturition also. Yes, parturition also positive feedback mechanism. Oxytocin release, positive feedback mechanism. The question which I am asking you to think about is it helping homeostasis? So what variable is being maintained? What is the variable? You take example of parturition. So what is the variable that is being regulated? That this positive feedback mechanism helps regulate. Because if something has to be homeostasis, by definition, it will have to be something which regulates a particular variable. A mechanism as such could be, so somebody is mentioning blood volume in platelets. Now for that to be happening, you must be able to sense blood volume in platelets, alright? So contractions. So unfortunately, neither the contraction is being sensed for regulation. You don't regulate. So somebody nicely mentioned prematernal condition. Yes, theoretically yes, that the whole idea is to bring back the whole thing back to the prematernal condition. Yes, in a way. Or somebody could also say it is for maintenance of the species. That's why this is a part of larger homeostatic mechanism, continuation of species. So in that sense, you could go beyond human body and use the term homeostasis. But we will restrict it to the way the Walter Cannon used it. So let us read this. Blood vessels carry blood. Damage to blood vessel leads to loss of blood. On breach of vessel wall, negative feedback mechanism initiated to prevent blood loss. This process is called hemostasis. So hemostasis is a negative feedback mechanism because there has been injury, the blood is getting lost, it needs to be stopped. Okay, and an important part of this negative feedback mechanism is formation of platelet puck. So I have a positive feedback mechanism which is part of a larger negative feedback mechanism to help stem the loss of blood. So you could theoretically sort of argue that a positive feedback mechanism per se will of course destabilize the system, but when it's part of a larger negative feedback mechanism, it becomes part of homeostasis. Okay, correct. So are you with me on this, that how a positive feedback mechanism which per se doesn't make sense as a part of homeostasis. Only when it is part of a larger feedback mechanism, then it does make sense. And what is the purpose of this positive feedback mechanism? It could be thought of as an amplification process, that something which needs to be done very fast, very large scale, then make it a positive feedback mechanism. Otherwise, the sensing which is required to initiate that large scale activity may take longer time. So a positive feedback mechanism perhaps serves to amplify the process or make it expand in a larger time domain or in a space domain. Okay, so we spoken of two mechanisms: a negative feedback mechanism, perhaps J-Simon maybe. Okay, so all these are thoughts that become the part of our discourse. So negative feedback mechanism, homeostasis, we spoke of two mechanisms. Negative feedback mechanism, which obviously makes sense. A positive feedback mechanism makes sense as far as homeostasis is concerned only when it is seen as a part of larger negative feedback mechanism. Otherwise, it doesn't make sense. The third mechanism that we speak of is feed-forward mechanism. So I gave this example in terms of the drinking water, and even before your electrolytes have changed, you stop drinking water. That means the mechanisms have given a feed-forward calculation that this amount of water intake is sufficient for restoration of electrolyte. Let me give you another example. So let us look at this example of core body temperature. So we have core body temperature 98.4 degree Fahrenheit, and your regular mechanism is shown as negative feedback, and there is an external input shown by thunder, yellow thunder shape. Okay, so please read this. Now imagine that there is another external input to this system and interferes with the communication between sensor and processing unit, such that the processing unit gets incorrect information about the core body temperature, say 95 degrees. That means your core body temperature is still 98 degrees, but something happens and the processing unit gets the information that is 95 degrees. So this processing unit compares this encodes incorrect information with the set point and initiate mechanism that generates heat and prevents body loss. That means even though the core body temperature was normal, some external input initiated mechanism to conserve heat. Okay, let's look at a real life situation. Okay, so shivering is an important mechanism to maintain core body temperature and protects you in cold environment. So questions to you: how many of you have shivered immediately as you stepped out of house in cold winters? And how many of you have shivered with first pouring of cold water while bathing? Some of you definitely? Yes, no? Lovely. Okay, so we have brave people who still use cold water while bathing, even though we've got heating capacities. Okay, so now the question to me is, a question to all of you is this: what made you shiver? Did the first exposure to the cold change your body temperature? Yes, Basu, they are very brave who still use cold water in cold winters. Okay, so let's come back to what I'm discussing with you. That when you stepped out in the cold winter, or when you put the first cold water on your body, it didn't change the body temperature, but you still shivered. That means it is almost anticipating the system, your neural mechanism anticipates that if you don't do this, okay, somebody saying before pouring of water, okay, possibly. So there's an anticipation system. That means if you now look at this particular negative feedback mechanism, yes, surface receptors, correct. So this diagram basically tells you the same thing. What we regulate is core body temperature. There are receptors in hypothalamus which sense the core body temperature, integrators in hypothalamus, shed points, and shivering. But the moment you put cold water on yourself, the skin temperature goes to the somewhere in between the receptors in hypothalamus and integrators. Somewhere it interacts, and this interaction leads to shivering even though cold body temperature is normal within the range. And this what we called is the feed forward mechanism of homeostasis. Is everybody okay with this? Lovely. So that is what, so we spoke of, okay, I'll repeat that. So in a negative feedback mechanism, the shivering must occur only when there is change in core body temperature. So even if I am exposed to the cold, I should not have shivering till my body becomes cold. Yes, it is called as homeostasis. It is a mechanism of homeostasis because it is attempting to maintain the internal environment, and therefore it is a part of homeostasis. So homeostasis has three mechanisms: negative feedback, very dominant mechanism; positive feedback, usually as a part of larger negative feedback; and feed forward mechanism, again very common. So if you have access to the internet, all of you do have, I will request you to, because I like Casey Stoner, so I'm going to ask you to let me go to this particular, I don't know whether they will give me YouTube here or not. Yeah, it's giving. So okay, so I'm running this video, and you can see Casey Stoner almost at about, I don't know, 30 degrees, and turning. This is a super slow-mo, 1000 frames per second. He's negotiating a curve, and the bike is almost, his elbow is touching, body is touching, he's almost off the vehicle, and is perfectly balancing out and moves ahead. So back to the Casey Stoner. So why do you think the Casey Stoner was bending?
And out they go for the US Grand Prix. It looks like a decent start from Rossi on second in the grid also.
Okay, somebody is watching and the video is coming on to me. Okay, I'll have to stop the GP.
Valentino Rossi goes through and leads in the US Grand Prix.
Okay, sorry, I didn't shut the YouTube. Back. Right. So somebody mentioned it is for balance. So would you call his body bending an example of negative feedback or a positive or a feed forward? Is it negative? Exactly. Feed forward, Ishita, Vineet, Akram, lovely. So basically you've understood what I meant by feed forward. Right. That means the machinery in his own body is able to look at what is going to happen and bends to counterbalance the centripetal forces or the centrifugal forces. And this is happening in at a millisecond time scale, with whole body working together, head, legs, everything. Of course, it takes practice to achieve this. And as a physiologist, you would love to understand how the hell this is happening, because you look at various robots that engineers are creating. I mean, see how clumsily they walk. And it is the hope that some of us with the AI softwares and everything will finally be able to make a robot walk with that finesse of a human being or an animal or a leopard running. So even the lowest of the lowest animal has a fantastic machinery to be able to balance us in a feed forward manner. All of us do that. We just don't have to be even taught. Even riding a bicycle, we all are able to do. But of course, to get the finesse of Casey Stoner, you have to practice a lot and with hopefully some natural talent. So I hope that everybody understands now the difference between a feed forward and negative feedback. A negative feedback would have been, first he goes outside and then he overcorrects himself. That doesn't really happen. Okay. Now, I have only 7-8 minutes, maybe. Yeah. So quickly, if you can just, I know you've already given your exams and passed all your exams to come to AIIMS, but still do this experiment for me, please. Do the calculations. Okay. We are given two cases. And given the answers. So if you see these two examples, in one example, the change of pressure was larger. So in case 2, the change of pressure was 60 millimeter and the change of heart rate was 60. In the second example, in the first it was 50. In the first example, the error that was still left was 10 millimeter. In the other, it was 20 millimeter. So if I ask you a question, which of these two systems, which of the two negative feedback mechanism is better? You have to compare them quantitatively, qualitatively. Which is more efficient? I could use terminology. Which is more efficient? Which is better? How would one go about computing this? So Alisha, why do you think so? Himanshi also says second. Why do you think, what makes you think that the second is a better, more efficient system? If I could argue that there is still 20 millimeter left. If I argued that the first one, the error left, yeah, but what if I argued the reverse way, that oh, it is still 20 millimeter is still left, so it doesn't help me. So it restores more, but also leaves more error.
First one.
Yeah. So we have got different ways of looking at it. So all of you have your own views. Now Shubhang says one, somebody says get a time. So we have to come to a consensus, right? As to how do we quantify a system. Okay? So we have people with 1, people with 2. So take time constant, we can see per unit change in time. Lovely. Fantastic. I mean, all of you are giving the ideas that are correct. But when we live in a world, we have to decide what I call as efficient system. Okay? So let us look at these systems, way of quantifying homeostatic processes. One, as somebody mentioned, it could be ratio of input versus output. That means a ratio of change in BP versus change in heart rate. It could be a ratio of error introduced versus error left. It could be percentage of error over error introduced. So you could find multiple ways of computing. The one in the middle is what Guyton prefers. Gain is defined as error left, error introduced ratio. So in this previous example, if we went back, so let's look at the error introduced versus error left. Let's go back. So in the first one, the error left was 10, error introduced was 40. So we have system gain as right, okay. And in example 2, lovely. So if you use this definition, then the case 1 is more efficient. Okay, but this is Guyton's view. I have no quarrel with somebody who says no, I don't think this is fine and I want to use a different one. Please do so. Okay, you're free to be thinking in your own ways. But when you talk of consensus, this is what the consensus would be. So let us say if there was a system in which there was no error left, everything got corrected back to the normal. What would be the gain? No error left, error 0. Infinity. Lovely. So we do have examples in our body where the gains are infinity, or gains, for example, temperature control system is very robust. It has a gain of about 33, which basically means if there was error of 34, 33 would be corrected. Very, very robust system. The other feature of homeostatic mechanism is time to respond. So in the previous example, there was 9 seconds it responded. Okay? Time to respond. Somebody also mentioned the rate of change or time constants. I would actually prefer time constants as a better examples of dynamic changes, but we can also take a single point example of as a 9-second change of initiation. Okay, so a lot of physics and mathematics will come into picture when you begin to quantify physiological processes. So we could look at time to respond, time to correct, and I'm giving some examples. So barrow reflex that we spoke of as a gain to 3 and 4, and you correctly quantified it. I mean, I'm using a definition which is of Guyton's view of ratio of error introduced versus error left. Different authors, different people have their own ways. Please look at what do they mean by when they say a gain change. So regulation of blood volume, infinity. So if I lost some blood in an injury or I got dehydrated, my homeostatic machinery will make me drink water and I will actually get my blood volume back to exactly normal. But it may take minutes to months to be able to get that to that particular level of infinite level control or regulation. Okay. So last few minutes, quickly revising. So I hope that you have understood what is a regulated variable, what is a controlled variable, afferent, efferent, integrator, set point, and features of gain and lag, and three mechanism of homeostasis. And I'm using the word three mechanism of homeostasis. So you must say negative feedback mechanism. I'll come to Pankaj. Just hold on. So three mechanism of homeostasis: negative feedback mechanism homeostasis, a positive feedback mechanism of homeostasis, and a feed forward mechanism of homeostasis. Please note, per se a positive feedback or a negative feedback, don't assume them to be part of homeostasis. For something to be part of homeostasis, they must satisfy the condition that something is being regulated, something is being controlled to bring that particular variable back to the normal range or the stable ranges. Only then you say this is a negative feedback mechanism of homeostasis. For example, many times students tell me, I ask them as an example of negative feedback, and they tell a chemical reaction. A, B react, the product then inhibits the reactants. That is a negative feedback, but it is not a negative feedback mechanism of homeostasis. So be a little careful between negative feedback mechanisms, negative feedback mechanism of homeostasis, a positive feedback mechanism, and a positive feedback mechanism of homeostasis. Similarly with the feed forward mechanisms. Are we on the same platform, all of us? Yeah, somebody was talking about integrator. Can you just come back with the question again? There was something about integrator. I could not understand the question. Pankaj had something to integrator. Yeah, Pankaj, can you elaborate what is it you want to understand or query? Okay, maybe Pankaj will come again. So I will. What is the term integrator? Yes. So let me then go back to the diagram. Okay. So in this negative feedback mechanism for blood pressure, nucleus tractus solitarius and all other neurons which integrate the information from the sensors, compare it with the set point, and accordingly activate the efferent mechanism would be called as integrator. What is gain and lag? Okay, maybe gain and lag. Maybe you missed out on our discussion of these examples. Darshi. So, Pankaj, Robin, not necessarily. A CPU would be the whole brain. You would need CPU as such may not be a perfect example because the whole brain is effectively a CPU. You would look at a particular module in the brain, a particular module for that particular homeostatic function. So not all parts of CPU would be the integrator for that particular function. Darshi, I will not get right now, maybe I'll touch upon it again later because it will take me 5 minutes to talk about gain and lag again. Before I leave, I would like you to see this particular diagram and give me your views about it. Okay. So here I have A, B, C, D. A leads to B, B leads to C, C changes D, and A is restored. So on right I am giving an example. There is a hot summer. It leads to evaporation, cloud formation, it rains, temperature decreases. Would we call this process as homeostasis? Your views, please. What if somebody said, oh, this is natural homeostasis, you know? So occurrence of rain is an efferent mechanism, evaporation is the afferent mechanism, and there is somebody, gods, who are integrating the whole stuff, and therefore this is an homeostasis, of course, applied to nature. So we have views with some agreeing to it, some not agreeing to it. Okay. So somebody says there is no set point. Okay. But then I would argue from the other side that there is no set point ever found for human body also. We think it exists, but nobody has ever found a set point for temperature, a set point for blood pressure, a set point for glucose, a set point for anything. So, you know, you could argue from both sides. So body has a set value. Yes, one could say that even the environment has a set value. If the temperature goes beyond that range, therefore the evaporation, because we never reach 100 degrees centigrades. It's always between, say in Delhi, between, in a particular season, between, you know, 10 degrees here and there. Okay. So what I'm basically asking you to differentiate between two things is, one, where there is an active mechanism, and second, which is consequences. Okay. Consequences. So heating leads to evaporation. It's a consequence. I think I will agree with what Ishita is mentioning. So what Ishita is saying is this. Let me read what Ishita said. So evaporation just happened. It was not sensed. Okay, and therefore the integrated concept is not applicable. And I would agree with this. I mean, like I said, we are here to here to discuss, look at the ideas, and develop new ideas if the old ideas don't work well. And nobody's word is final, not mine, nor Ishita's, and not the others. Everybody has you are all intelligent people. Think about it. Don't just take because somebody wrote 10 years ago, somebody wrote 15 years ago, somebody wrote 1000 years ago. Don't take their word for it. Think about it. All right. So what I view is almost coinciding with what Ishita is saying, or Alisha perhaps is saying, is that because there was no sensor. So if I were given a situation in a human example, and if I were asked to quantify whether this is an example of homeostasis or not, I would first look, is there an integrator, is there a sensor, number one. If there is a receptor, sensor, then I will say, is it linked to either an efferent mechanism? I would link it up, and I will see the whole reflex arc, whole chain. Only then would I call something as a mechanism of homeostasis. Otherwise, I would reserve my saying, I don't have sufficient information. It's better that way. I don't have sufficient information to say. But in this example of environment, though it looks like homeostasis because you have all the features, it has a gain, it has lag time, it has components, its temperature is coming back to normal within the range. It seems to be negative feedback, but it is not homeostasis simply because there is no sensor, there is no integrator. Okay. Last slide before I close. I've overshot by a couple of minutes. Issues related to set point. And right from very beginning, I've been telling, even though the model that we use requires a set point, the integrator must compare with something. Okay. But is there a value? Is there a set point somewhere in the body? We don't have any evidence. and therefore should we re-examine this model and present an alternative model that doesn't require a set point? And this is something which I hope some of you will ponder upon, and maybe when we meet in physically after a couple of months, we can sit down, have a cup of tea and discuss this particular alternative model. Though this model will not be required in your exams, negative feedback, positive feedback and definitions of homeostasis will suffice. But I'm sure none of you want just to restrict yourself just for examinations. I mean, those are small part of your living for rest of your life. Exams you will pass, all of you will eventually, okay, not if not in the first attempt, but that's not what is going to define you as a doctor. You do not lose your desire to think, your bubbliness to question things and become part of the system. Do we have time for this? Mahesh again wants a feed forward example, or somebody will call Mahesh and explain. Mahesh's friend. Lovely. Gurkirat. Okay. Or maybe Robin is going to tell Mahesh the example. And of course, cup of tea would be definitely good for me too. Thank you all. I'll meet you again. I don't know when my next lecture is. So, okay. Robin Yadav, somebody is mentioning. Robin? Okay. Robin has mentioned his email. Robin is with us in the Department of Physiology. Bye everyone. Thank you. Shivering. Shivering is not part of positive feedback cycle.
Excuse me, sir.
Yes, please.
Sir, can we define fast feed-forward mechanism in just one statement?
Okay. Why do you look for one statement? I'm a little more curious.
I'm just confused between three statements which I just grasped from your lecture.
Yes.
I'm confused between those three.
Can you just elaborate so that I can help you out?
I'm not so clear about the conclusion which I have grasped from your lecture. That's why.
Yeah. So let me now state in a more of statements. So homeostasis is achieved by three mechanisms, okay, that we speak of. One is a negative feedback mechanism, wherein when an error occurs, mechanisms are initiated to correct the change. So error must occur for a negative feedback mechanism to operate. A feed forward mechanism of homeostasis, in this the mechanisms are initiated even before the error has occurred. All right?
Okay, sir. Okay.
Okay. So for a positive feedback mechanism, feed forward mechanism, the mechanism is initiated even without or before a change in the regulated variable, and these changes prevent a change in the regulated variable. Basu, I am not too interested in your exam oriented things. I want you to be, beyond exam. You've given your exams now. No more. No more getting top marks or top less marks. I would be more happy if you can explain things without those mugging up definitions. I mean, okay. Patients don't ask you definitions. They want you to treat them very well. Okay. But I understand the concern. We are so used to these definitions, repeat verbatim. Memory is so valued, unfortunately, in our system of education, that we tend to say define this, define that. I mean, as long as you understand, no matter what language you speak, it's good enough. Oh, thank you, Basu. I'm just waiting for everybody to log off. Yes, please.
Now, we consider positive feedback as as a part of homeostasis.
Could you just type it in? It's difficult to hear because I don't have a good audio here. You just type it out. So, Kritik Agarwal. Okay, so he puts a question that this concept of gain and lag useful in medical practice. Actually, if you're looking at a great doctor, yes, absolutely it is. For regular medical practice in this country, you don't even need a degree. Okay, but if you really wanted to treat a patient with minimal of intervention, absolutely. Somebody with understanding of how much time is going to take. So let us say, somebody has diarrhea, okay, and you do blood sampling, and you find that I'll come to Manasa's question first. Let me respond to Kritik Agarwal. So let us say a patient came to you with diarrhea, and 3-4 times a day, and now you have to decide whether should I give a treatment or not, or should I just ask the person to take ORS. Now what you do is you take a blood sample and you measure all the parameters of internal environment, and you see that person has hyperosmolality. So what do you do? So you ask the person to take ORS, and again person takes ORS. You take another blood sample after a couple of hours, and you see that things are changing, things are improving. So you understand that the body mechanisms are responding. They're responding well. They have the time lag. Don't have to take sample every 2 minutes. So you would say, let me take a sample after 1 hour, 3 hours, 4 hours. So in a way you are giving, if you know the time required for system to recover, and therefore you initiate treatment at the right time. In that sense, the gain and the lag would be very, very helpful. Okay. So let us say a person has injury, and person seems to be normal, but the heart rate is very high. Instead of having a heart rate of 80, the person has a heart rate of 20. What I understand by this, even though the BP appears stable, but the heart rate is very high, I will understand that this person must have bled quite a lot. The system is now running very heavy just to maintain BP. Another person, also stable BP, but heart rate is 100. So this could give me that the second person is showing a larger response, maybe has a better gain system, and then I will be able to intervene at the right point. So yes, the concept of gain and lag would be extremely useful, provided as as medical experts we use it. Unfortunately, most medical practice, implicitly many of us use it, but we don't. Totally agree, Kratik, totally agreed. I mean, in India, patient would change doctors if you don't give them medication, okay? But not so in current ethical medical practice. So if a patient came to me with diarrhea, I will just keep giving me ORS, keep taking even for 7 days, 10 days, doesn't matter. Unless there are other sign symptoms which tells me that I must intervene. For example, a fever begins to occur, or there is blood in the blood in stools, or mucus in stools. Then I would say maybe I will initiate an antibiotic. Or if there is vomiting and despite ORS, there is further increase in osmolality, then I will start an IV line. So all those things will be done step by step manner. Not that the first time patient comes to you with diarrhea and you start on antibiotics. That of course is a trouble with our country, and I'm sure with the neighboring countries as well. That we start on using these drugs even when it's not mandatory, because like you said, the patients lose trust, and they don't seem to lose trust in Western countries. Somehow they lose trust in India because there are people doing malpractice. And I use the word malpractice in the sense that when you don't do ethical practice, it's not whether you taking money or something from the patient. If the medical advice is given with the concern of what the patient thinks or what society thinks, or you won't be actually doing ethical medical practice. But those are the realities of our life, our country. Pratik. So coming to Manasa's query, do we consider positive feedback mechanism part of homeostasis? Yes, we do. Kratik, yeah. Okay, so yes, positive feedback mechanism is considered as a part of homeostasis. Though before considering as part of homeostasis, I always like to ask a question: what regulated variable is being maintained by that positive feedback? Because you will find that even something like action potential, opening of sodium channels considered as part of the homeostasis. I ask a question: what homeostasis is being done by this positive feedback mechanism? What variable is being regulated? Sometimes I don't have my answers, but we live in the same world, and if 99% of people are saying that positive feedback mechanism must be considered part of homeostasis, I succumb to it for the sake of peace rather than taking them on. So for very strictly speaking, I have my doubts about considering positive feedback mechanism as part of homeostasis, but most authors, most people, most physiologists would consider positive feedback as part of homeostasis. According to me, doesn't fit in the definition of homeostasis. I need to see it before I call it. Is it okay, Mansa? Right then, I think we have. It's 4:20. Bye bye. Yeah, if you don't exit, I can't exit. Yeah?
I'm also waiting for people to just.
Yeah. No, Basu, it's not revolutionary. There's nothing revolutionary about it. I'm not the first person saying this. It's just that I'm saying it aloud.
There could be a possible reason that people have fallen asleep. It's after.
Yeah. I will take credit for that. If I can put people to sleep, I would be in a treatment of insomnolence. Mahesh will discuss it next time. When I come back, I will retouch upon the feed forward and negative feedback. Looks like I may have to end session from here itself.
Yes, sir. That, people are suggesting that.
Yeah. Why disturb the sleep of people, it's a difficult thing these days. People don't get enough sleep. Let me see Bidweg's end stream. End meeting for all. Yeah.
Thank you, sir.
Thank you. Bye.